Shares in global vaccine makers fell sharply on Friday. Markets were spooked by US President-elect Donald Trump's pick to run the Department of Health and Human Services. He's chosen Robert F. Kennedy Jr., who has previously spread misinformation on vaccines. Kennedy, who is a vaccine skeptic, has been criticised for making false medical claims, including that vaccines are linked to autism. Several medical scientists on Friday said they were alarmed that vital vaccination efforts could be undermined. Shares in Britain's GSK were down over 3% at their lowest in more than a year. AstraZeneca and France's Sanofi were also down more than 2.5%. GSK and Sanofi offer a range of vaccines, including for flu and childhood diseases. Bavarian Nordic was hit hardest as it fell 16%, though it was also hurt by third quarter results. The drug maker produces a vaccine for Mpox. The Danish firm's CEO said they were concerned Kennedy could drive vaccine skepticism. German-listed shares of BioNTech were down more than 1/10. The company is Pfizer's partner on COVID-19 vaccines. Analysts pointed to a Kennedy interview on NBC in which he said that he would not take away available vaccines. But they added the overall prospects for biotech development ventures were seen as weakened. Europe's healthcare sector was the worst performer in early trading, down 2.2% at its lowest since April.
The problem with RFK Jr.'s ideas is that they sound really good on a bumper sticker, but when you go one step deeper, it gets very confusing very quickly. Well, so look, the health secretary is an enormously important, powerful position. This is a person who oversees Medicare. This is a person who oversees our entire FDA, which makes all the decisions about medicine, CDC. RFK Jr. has demonstrated, I think, over decades that he doesn't understand the basics of scientific thinking and of rigorous analysis. He says things that are just flatly wrong, and he peddles in conspiracy theories. Having someone like that at the top of our entire national health infrastructure, I think is going to harm people. It's going to really harm the health of the American people. The health secretary, again, has enormous influence. Certainly also will depend on who the CDC director is, on which vaccines are authorized and made widely available. But the one place where the health secretary specifically has influence is around coverage of vaccines and whether insurance companies will be paying for those vaccines or not, whether the federal government will supply it for low-income people or not. And if he makes decisions based on the way he's talked about these things, it will make it harder for all Americans to get vaccines and make it nearly impossible for poor people and lower middle class working people to get access to vaccines. Most health secretaries have not had a health background, and they have let the scientists at CDC, at FDA, at NIH make decisions. Kennedy's a very different flavor of a potential health secretary. He has very strong ideas, most of which are not rooted in evidence and data, and actually contradicted by evidence and data. He could end up having quite a large influence on what medicines are available to Americans. He could end up having quite a big influence on where NIH funds its research. Does it cover Alzheimer's, or does it cover obesity only, or what are the topics? He could end up influencing all of those things, at least indirectly, if not directly. So I think this is potentially a very important hire. We will see what he does with the job, but I think anybody who looks at his track record is going to be concerned about where he's going to go next. Yeah, look, I think we're going to start seeing impacts relatively quickly, because if it looks like he's going to get across, you're going to see some of the best scientists at FDA, CDC, NIH starting to leave, because it's going to be very hard to work under somebody who doesn't basically fundamentally believe in the scientific process. No, I think the big picture point here is that a lot of folks see this as this is going to affect vaccines. In fact, it's going to affect everything. What Medicare covers, what preventive services are free. That is a decision of the health secretary. So our mammograms continue to be covered for free. Our colon cancer screening is going to continue to be covered for free. All of those are going to be decisions that fall to him. One has to be substantially concerned about his decision-making on those, because I think it'll have a big effect on people's lives across the country.
I'm gonna require, and first of all, anybody who wants to take a vaccine, I'm not going to get in their way. If you want a vaccine, or if you want to vaccinate your children, those vaccines will be available. But I am going to tell the truth to Americans, and I'm going to do for the first time good science, right? When I was a kid, there were 3 vaccines, and I took all 3. There were 3 that were mandatory, that were recommended, which essentially means mandatory, and I was compliant. Today there are 72, and we're going up to now, I think, 77 or 79 with the annual COVID vaccines. So. And not one of those, with the exception of the COVID vaccine, not one of those vaccines has been tested prior to licensure in placebo-controlled trials, which are required for every other medication. So what I would do as president is I would require placebo-controlled trials, long-term safety trials that will look at efficacy, will look at safety, will look at the long-term impacts, and be able to inform Americans for every age cohort, whether that vaccine is likely to avert more problems than it causes for individuals. And I think everybody ought to have that choice.
So if there was another...
Robert F. Kennedy Jr., he came in. And he's going to help make America healthy again. And now he's a great guy, and he really means it. He wants to do some things, and we're going to let him go to it. I just said, but, Bobby, leave the oil to me.
Liddy, come here. Dilla. Come here. All of my policies are going to be science-based with the best science that's available.
It's not that bad. It's not no, it's something totally different now.
I don't know enough about the measles outbreak to say that. I don't know whether the measles outbreak is vaccine strain measles. I don't know what age cohort it's landing in. The problem with the measles vaccine is that it's a leaky vaccine. It doesn't provide sterilizing immunity, which means for a large percentage of the people who get that vaccine, it will wane in old age. So I think within 10 years, and I may be wrong about the exact numbers, but I think ultimately about 20 to 30% of the people who get that vaccine, it wanes. So they're now vulnerable to measles in old age, which is not good.
Sharon Ginsburg.
Hey, Stephanie.
Hi, Stephanie. Nice to see you. I heard someone yelling. I'm like, who's causing?